Good day everyone, I am Jerry Calabrada, a level 1 nursing student from the University of the Visayas, and in this video, I'm going to perform our return demonstration regarding administering parenteral medications. So, parenteral medications are given through a route other than the alimentary canal, which are intramuscular, intradermal, subcutaneous, and intravenous. The route that I will be performing in this video are intradermal and intramuscular. Prior to administering the medication, the nurse must consider the 10 rights in giving medication, which are right medication, right dose, right time, right route, right client education, right documentation, right to refuse, right assessment, and right evaluation. So prior to carrying out the procedure, we have to prepare the things and equipment that we will be needing in parenteral medication administration. So I have gathered here the things that I will be needing in the following procedures. So we have here vial of sterile water, ampule of sterile water, a 3 cc syringe, 2 tuberculin syringe, 2 withdrawing needle, alcohol swab, and tomato, because I cannot administer parenteral medication in this return demonstration without the supervision of a licensed nurse. I will be using this tomato, assuming that this is my patient for today, and we will be placing the equipment in a medication tray to make it convenient for us to carry the medication. And also, we have here a sterile gloves and face mask to protect ourselves and the patient from possible transmission of microorganisms. So now, let's proceed to preparing medications from ampules. So the first step is perform hand hygiene and observe other appropriate infection control procedures. This is to prevent contamination and possible transmission of microorganisms. So I've already washed my hands and I've already done my gloves. Let's proceed to the next step, which is prepare the medication ampule for drug withdrawal. Preparing the medication will save time and be able to withdraw the drug properly. So we prepare here the ampule, and I am going to clean and disinfect the neck of the ampule using the alcohol swab. Next is flick the upper stem of the ampule several times with a fingernail. This will take all of drugs down to the ampule's primary section. Next is place a piece of sterile gauze between your thumb and the ampule neck. The gauze shields the nurse fingertips from the shattered glass and any particles shower away from her. Next is break off the top by bending it toward you to ensure the ampule is broken away from yourself and away from others. This is so the nurse and other fingers and faces are protected from shattered glass. Next is dispose the top of the ampule in the sharps container. This is to prevent wounds and punctures of loose sharps. Assuming that this is a sharp bin container. Next is place the ampule on a flat surface because the solution dribbles out when the ampule is inverted, so put it in a flat surface. Next is attach the filter needle to the syringe. Make sure it is attached tightly so as not to leak the medication. So we are going to keep this original needle because this will be used in administering the medication later to the patient. So I am already attaching here the filter or withdrawing needle to my tuberculin syringe. Make sure that it is attached tightly, not so and not to waste or to leak the medication. Next is remove the cap from the filter needle and insert the needle into the center of the ampule. Ampules with broken rims are deemed tainted if the needle tip or shaft hits the rim of the ampule while it is inverted, the solution dribbles out. So after we inserted the tuberculin syringe inside the ampule, we will now withdraw the amount of drug required for the dosage. This follows the 10 medication rights to prevent medication error. So assuming that the doctor ordered me to administer a 1 ml medication to my patient, now I will withdraw a 1 ml medication. Next is dispose the filter needle by placing it in a sharps bin container. This is to lessen the risk of needle sticks, cuts, or punctures from loose sharps. Now I will get the cap of the filter needle again and I'm going to remove the filter needle. Now I'm going to dispose it in a sharps bin. Next is place the filter needle, tighten up the cap at the hub of the needle and push solution into the needle to the prescribed amount using the original needle of the syringe. We tighten up the cap at the hub of the needle and push the medication into the needle to the prescribed amount. To remove residue from the needle, change the needles after preparation and before administration. So we are going to keep this tuberculin needle with the medication inside the plastic, and we are going to administer and remove this only on the bedside table of the patient. We are going to place it in the tray to make sure it is free from contamination. So now let's proceed to preparing medications from vials. So the first step is perform hand hygiene and observe the appropriate infection control procedures. This is to prevent contamination and possible transmission of microorganisms. So I've already washed my hands and I've already done my gloves. Let's proceed to the next step, which is mix the solution by rotating the vial between the palms of the hands. Mixing ensures an adequate concentration and thus accurate dose. Some vials contains aqueous suspensions which settle when they stand. Next is remove the protective cap or clean the rubber cap of a previously opened vial with an antiseptic wipe by rubbing in a circular motion. The antiseptic cleans the cap and reduces the number of microorganisms. Next is attach the filter needle to draw up premixed liquid medication from multi-dose vials. The filter needles prevent the inadvertent administration of glass fragments when drawing up medication from glass vials. Next is remove the cap from the needle, then draw up into syringe the amount of air equal to the volume of the medication to be withdrawn. Before fluid is removed, injection of an equal amount of air is required to prevent the formation of a partial vacuum because vial is a sealed container. If not enough air is injected, the negative pressure makes it difficult to withdraw the medication. So assuming that my doctor ordered me a 1 ml of medication, I will draw also a 1 ml of air. Next is carefully insert the needle into the upright vial through the center of the rubber cup, maintaining the sterility of the needle. Air bubble through the solution could result in withdrawal of an accurate amount of medication. Next is inject the air into the vial, keeping the bevel of the needle above the surface of medication. The air injected to the vial will allow medicine to be drawn more easily. Next is withdraw the prescribed amount of medication, either A or B. A is holding the vial down, moving the needle tip so that it is below the fluid level. The vertical position makes the removal of air bubbles from the syringe easily. And B, inverting the vial, ensuring the needle tip is below the fluid level and gradually withdraw the medication, which is what I am doing right now. Inverting the vials prevents air from being aspirated into the syringe. So after which, we will put then the filter needle into the cup again, and then we are going to remove the filter needle and then insert the syringe again to the original needle, which is used to administer to the patient for medication. And then, we will dispose this filter needle appropriately on the sharp bin so that no one will be injured, especially the patient or collector of garbage. Now, we are done preparing the medication from vial and ampule.